Hey, my name is Palone. I'm a respiratory therapist. Today we're going to talk about what I do when a patient refuses. Before I get into what I do, I have a quick story time. This was early on in my career. I was hired for day shift and I took on my first OT night shift. I had a patient who had an order for nocturnal BiPAP. So I go in the room, I proceed to ask the patient if they want to go on, and he didn't look so great, but he was very adamant about not going to BiPAP. Like he was not having it at all. So patient refused. What can I do? That's my thoughts, right? I go to the nursing station. I begin to document in his chart. As I'm there, I get a page and it says nurse, and she is going off. Why is this patient not on a BiPAP? He's not doing so good. You need to come right away and put him on. And I'm literally legit at her nursing station at this time. And I'm starting to explain, like, hey, I was just there and the patient refused, and an overhead page goes off. It's a cardiac arrest and it's for that very same patient. Like, you can't be serious, right? So, unfortunately, the patient didn't make it. And this nurse was very vocal about she thinks the reason why he passed was because he didn't go on BiPAP that night. I went home feeling very scared about my career. And I was also very sad thinking that I didn't do much, like, I caused this patient to die, right? So, thank God, well, not thank God, but basically, this patient had a history of refusing care. So, nothing happened to me as far as my career. But moving forward, that experience definitely changed the way how I handle patient refusals. So, what I'm going to share with you is things that I learned over the years, and some good tips I got from nurse from nurses, supervisors, and other coworkers. Okay. And before I move forward, I just want to state that the patient has a right to refuse. It's their body, their prerogative, their life. They have the right to refuse any care, any treatment, any test that is ordered. Okay. So the first thing I do is I get curious. Now, I'm very mindful about the tone I use, but I definitely ask them, is there any reason why they're refusing the care? I'll be using BiPAP at night as an example because I work at night. But this work, like what I do, works with patient refusing from all different types of care, like even ABGs. So I like to get curious, and I'm basically asking in a inquisitive tone, in a help me help you. Like, is there something? Is there any reason why you don't want to use a BiPAP besides outright refusal? It's usually one of these two other things, where one is just a lack of knowledge. The patient is not aware of the reason why the test or treatment was ordered, the how it will impact their care. So that's a teaching moment. The second thing is a preference issue. Like, for example, they might not like the size of the BiPAP mask. They might not like the humidification or the lack of humidification. Now, if it's conducive to their care and it is within my means to make those changes, why not? I do it because they get well and go home sooner. And another thing I notice is those same patients that don't comply when it's something small like MDI puff, Q6 or something like that, they end up on continuous a few hours later because they skipped out on the basic care. Does that make sense what I'm saying? Like, a patient refuses BiPAP when their CO2 is high, but then they end up intubated. So it's worse for the patient, it's worse for us. It's more work for us later when we can't get them to comply. So if they're definitely still refusing, the second thing I do is I assess the patient. So I like to get their heart rate, SAT, respiratory rate, listen to breath sounds, and again, use your judgment because not everything that they refuse, it will be necessary to get these things. But even with an ABG, I like to at least get a SAT, right? I like to get I like to get these vitals. I like to state that just the patient's refusing, but this is what the patient looks like, whether it's good or bad. Patient refused this, but patient looks fine. Patient refused this, but patient doesn't look so good. And we're aware. We are not neglecting this patient. The third thing that I do is right before I document those vitals, I like to communicate with the team. I like to and again, use your judgment. I'll either do nurse and or the provider that ordered the test. That ordered the care. I definitely like to let the nurse know, hey, I was there, the patient refused BiPAP at night. And I like to include, a little bit of the vitals that I found, right? Not everything. Like, hey, the patient, hey, I just saw bed 10. He refused BiPAP, but he's citing 100% and he looks good. Or, hey, I just saw Mr. Smith. He refused BiPAP, but he's only citing 89 on 2-liter nasal cannula and he doesn't look so good. If anything changes, hit me up and I'll come back and put him on, right? So I think it's very important for the team to know that you attempted to give this care and this is what the patient looks like. Before I implemented this, I will notice that I'll do my rounds. Is now my downtime, and I'll get a page from the nurse. Hey, there's an order for this patient to go on BiPAP. Can you please come put them on? And then I'll respond, hey, yeah, I was there earlier and the patient refused. Then she's like, okay, maybe less than an hour later, I might get a page from the provider now saying, hey, I know the patient refused, but his gas is not looking so good. So we spoke to him and now he was willing to try to go on BiPAP. And 9 times out of 10, this happens during my downtime. Okay. So what I realized is if I can communicate them with them sooner, like if they're going to convince the patient to take the treatment, I rather that happen while I'm still doing my rounds and it's still early on during the shift and I don't get interrupted during my downtime. So you see, like that helps the patient, that helps you, so win-win here. Let's just recap what I do. One, I get curious. Two, I assess the patient, and three, I communicate with the team. If we apply those things to my earlier story time, not that I think the patient would have survived, because when it's the patient's time, unfortunately, it's the patient's time. It doesn't really matter what you do. Actually, that's a lie. Let me take that back because it does matter what you do. But again, it might not have changed the outcome of the patient. But I definitely would have went home knowing that I did my best. You know what I'm saying? Like I signed up for this job to help people. Like I know how it feels to not be able to breathe, and I just want to do my best and help the next person who's experiencing that get better and go home to their family. So one, it helps the patient and it also helps cover yourself. You never want to be put in a situation where they're questioning why a patient didn't do well and if you did your job properly. If there's anything that you do when a patient refuses that I didn't mention, put it in the comments. Like I'd like to know. Like maybe I can implement that into the things I do. You can learn something new every day. Now, have a great day. Take a deep breath and just know you're doing great.